Hello, everyone. Welcome back to another segment of Real People, Real Conversations. Today, I am joined with Stephanie McGuire, and we will be talking to George Rice about first responder mental health. George, tell us a little bit about yourself.
Hi, it's really good to be here, Maria and Stephanie. I am I'm a paramedic. Been in EMS for over 30 years, and but I've had a very large passion for mental health, especially in public safety, and I had the opportunity to become a mental health first aid instructor, and then help with the mental health first aid for public safety program that SC Thrive is doing.
Perfect. Well, it's really great to have you. I guess I really just wanted to go ahead and start this conversation up with the basics. What does a day look like for a first responder?
Well, the interesting piece is it can be 8 hours, it can be 12 hours, it can be 24 hours. Now it can be 48 hours. There are paramedics and EMTs in the state of South Carolina that are actually working 48-hour shifts, so they work 48 and they're off 72. The biggest piece is heading off to work, whether that be at 5 in the morning or 5 in the evening, and they head to their job. They typically get their ambulance assignment or their EMS vehicle assignment, and they as quickly as possible they make sure that they have all the equipment that they're supposed to have in their vehicles. And but unfortunately, there's often times where they will get to work and they're met by the tones to tell them that they have a call, and so it's a very around South Carolina, EMS is extremely busy.
No, for sure. I bet. I mean, that's very different than when I get up in the morning, I get ready, I go to my office and I'm done, by around 5 o'clock. So something I definitely want the audience to understand too, aside from the busy schedules, is what are some of, stressors facing first responders? I know they can be very different compared to the average person.
Well, the first stressor is obviously the unknown. The first stressor is the unknown of not knowing what they are going to encounter during their shift. And then the second stressor for many is childcare and telling their kids goodbye, getting their kids to school or picking their kids up from school. Those are stressors as well. And then there's the environmental stresses like right now with the heat and that sort of thing.
Yeah, so because their day is inconsistent, they could drop off their kids in the morning and then all of a sudden their shift ends up being longer. So then in the middle of an emergency, they have to figure out how to pick up their kid from school because they're no longer able to go pick them up. Wow, yeah, no, that can definitely be very stressful. Tell me a little bit about the work-life balance. You did mention kids in school, but as an EMS, how do you find that balance between work and home and not bringing your work home?
That's why mental health first aid is so important, because we're trying to introduce that. Mental health first aid is actually an attempt at changing the culture of EMS. There are a lot of things that we are doing nationally in EMS to try and change the culture of EMS. And one of those is self-care. So typically self-care is not in the vocabulary of people that are in public safety. So it can, what we're trying, obviously our hope is that we can bring organization to what right now is it's what right now is a very tough time in the life of a first responder to manage that balance. A dear friend illustrated this recently using a seesaw. It was always cool growing up where you'd be on a seesaw with somebody else, and it was only cool till somebody jumped off and then your part of the seesaw landed on the ground. So finding that balance in being a first responder is extremely tough.
No, for sure. What are some things that you think that the general public need to know? Because, unfortunately, I speak personally, me being part of the general public, I don't really understand too much of like, what goes into being a first responder, the stressors that go in it. So what do you think is something very important that people like me should know?
Being a first respond Being a first responder is a passion that people have. It's something. It's a many people they that are in public safety will see it as a gift, and it is a gift. It's a gift to help others. And as you go throughout a day as a someone in public safety, you're stepping away from your home, and you're literally putting your life on the line. Each day, you take an ambulance, for example. An EMS unit gets a call, and they are now going with lights and sirens to a call. And to get to the call, they are driving in the opposing lane of a road. They're having to stop at red lights and then keep going. So they're driving emergently to a call. Unfortunately, this past week, a first responder lost her life in a collision when her
Mm.
ambulance was involved in a collision. And unfortunately, we do lose um, first responders every year in ambulance collisions, situations where they're working on the side of the road, caring for someone, and they may get hit by a car. And also, we have paramedics and nurses that are in helicopters, and we lose a number of responders from helicopter crashes.
Wow, I'm so sorry to hear that. And our hearts and thoughts go out to the families of that first responder and the entire team. George, it's so difficult to hear that things are happening because you're right. First responders they're the first ones on the scene. They're the first ones to respond and not knowing what situation they're going to encounter. And so, and you and I have had conversations about, uh, that churn time, from going from one call to the next and having a very short window of time before you have to go to the next call. So what resources or support groups are out there for first responders that you know of?
So it varies state to state. There are 5 states that have really put into place um, resources for EMS responders. We are trying, hopefully at some point, to be similar to Canada, where in Canada it's now a priority that paramedics get counseling, that they get education on what's involved in being in EMS. Here in South Carolina, we're trying to accomplish that now, so that any person that's in the emergency medical technician class, that's our first level of instruction. When they're in that class, they would actually get the mental health piece of how to take care of yourself, and also to the mental health piece of knowing what are some of the things that they're going to encounter when they're working.
That's good. And then you are leading the way on another initiative that we have, of course, with Mental Health Matters. And I think that's a great resource. Do you want to talk a little bit about that?
So, Mental Health Matters is just an incredible program. It's a nationally accredited course. It is backed by a national organization. And it is the first time in my life that I have actually been involved in a program where I'm able to educate people about how to respond to people, what my body language should look like, what my communication should be like, what my my facial expression, my posture, um, and then also what are some of the we look at people that have physical ailments. They may have chest pain. They may be a diabetic. They may have had a seizure. Then there's an individual that may have been in a vehicle collision. They may have fallen from a height. But we need to know, as EMTs and paramedics, we need to know how to take care of people who are hurting inside.
Mm-hmm.
And right now, for instance, there are people that are losing their loved ones. There are people that are their loved ones are in the hospital, and there's not a coping mechanism for that. So I may be as a paramedic responding to an anxiety attack, and I need to be able to know how to talk that person down from that anxiety attack. And just by being calm and having a positive posture and reaching out to that person, I can take them from a frantic time to a time where they're more comfortable and they have a better opportunity of making the decision on what's next. What's next may be getting self care. What's next may be going to the hospital and getting some care, or reaching out to a counselor or a physician.
Absolutely. And I'm glad you talked about that because I was going to ask, what are some of the warning signs or, things that that a first responder that you may have seen that may be facing a mental health problem or just a concern, like you kind of touched on anxiety and things like that. But what are some of the other warning signs that maybe you have seen or that someone may be experiencing?
The word assume is so big in our world, and
Mm-hmm.
when we are out, we may be at the grocery store, we may be at the department store, we may just be at a park, and we may see someone that doesn't that may be out of sorts, that may be acting irregularly. That's a tough word, but they're having trouble coping at that moment.
Mm-hmm.
And unfortunately, in this day and time, we may think the worst and think that their problem is actually related to substance abuse or something else, when in fact there's a very good chance that it's not substance abuse. If you take, we always use the vials AEIOU. Well, AEIOU is one of the ways that we use in the field to try and find out why somebody may be out of sorts.
Mm.
And then we follow it up with tips. So we use AEIOU tips, and because they may be a diabetic, they may have had a seizure. A seizure doesn't have to be a full convulsion. It can just be a seizure where somebody's having a focal seizure. It can
Mm.
be infection. Sepsis is a big thing these days, and there are a lot of people that are suffering from infections that can be out of sorts. And of course, all of these situations include some type of behavioral issue or neurologic issue that's going on where they need our help. And that's where we also bring in algae, and we can talk about that in a minute.
That's good. I'm so glad you brought up algae too. And so, in talking about support, one of the things, of course, you kind of alluded to the mental health first aid course that we offer at SC Thrive, and you're being one of our instructors. How can families support their loved ones that are first responders?
So the A in algae is assess,
Mm-hmm.
and the biggest thing that we earlier we talked about assuming. Instead of assessing, instead of assuming, we need to assess.
That's good.
We need to
Mm-hmm.
assess and make sure that everything is safe and look at the whole picture. Look at it. Take in everything about what we see. And then the big one, which is priceless, is L, which is listen.
Mm-hmm.
And this is a priceless event because so many people, I'm sure that all of us every day will hear at least one person say, nobody will listen to me. Nobody
Mhm.
listens. It may be
Mhm.
the help that they're trying to get on the phone for something to do with their home or whatever it may be, but people over and over throughout the day are going to say nobody listens. So the greatest tool we have are our two ears, because as they said, often it's often said that God gave us two ears and one mouth, and that's so that we can talk less and listen more.
I agree with that. Absolutely.
Then we have give, G, which is for give encouragement. And um, one of the things that we can do is literally get in a position where we are face to face with that person, sort of eye to eye, not necessarily face to face. Obviously, now with the with COVID-19 and the environment that we're in, it's always safe to have a 6 foot stance with someone. That is a safe thing. My arm is 3 feet long, so I have a 37-inch arm. So if you're within 3 feet of me, you're not in a safe position for yourself, because whether we want to talk about it or not, there are times where we don't need to get within arm's reach of someone.
Mhm.
And so having that 6 foot distance is important, but we can literally get down on one knee or sit down so that we're face to face with the person and not towering over them. Besides having a 3 foot arm, I'm 6'5". So if I'm speaking to somebody that's 5'6" or shorter, that's very intimidating to the person, and it's not going to help them feel comfortable. It can make the situation worse.
Mhm. That's true. And then I think, I guess my other question would be, is there any support for the families on the other end? You talked about caregivers and caregiving for someone who may be experiencing a mental health problem or concern or challenge can be stressful on the caregiver themselves or the family member. And so, do you know of any other support that's out there for families? Again, you kind of talked about Mental Health Matters, which is our bi-monthly webinar that we have on at SE Thrive on our Facebook page. Is what is it, second and fourth?
Second and fourth Thursday at 11:30, we are addressing a lot of the topics that impact caregivers.
Mm-hmm.
I found myself caring for my mom and dad and being an advocate for them, and even in when they were in their 60s and 70s, everybody needs an advocate. And we
Absolutely.
just got through doing an incredible program on autism, and
Mm-hmm.
autism affects people, children and adults, and every person needs an advocate. Right now, every person needs an advocate to get through every day. You have to have. That's one of the biggest things that we stress in mental health first aid, is you have to have that go-to person. You've got
Mm-hmm.
to have that post-it note with a phone number on it of somebody that's agreed to be your friend, somebody that's going to be there for you in the thick and thin. And then for people that may not have that friend, there are organizations that are just one phone call away. The number of caregiver resources has grown greatly in the last year, and they're just like the Department of Mental Health here in South Carolina. They now have teams in every county that are there to help people and help the caregivers, because quite frankly, as we all know, it takes a lot for somebody to get help. In our mental health first aid program, we teach that it may take 10 years
That's
to
right.
properly diagnose somebody with a mental health condition. So think about those caregivers that day in and day out for 5 and 10 years have been trying to get help for their family member, and it's they've had that glass ceiling effect of bumping their head.
Absolutely. And I applaud you for saying that. I do applaud you for the work that you do around in our state and how you're helping families be safe, not just from a paramedic standpoint, but also getting them the help that they need on the mental health side. And so we are so just thankful to have you, George, part of our team. And I think what I hear most out of this conversation is that help is available, right? That's kind of what my takeaway is, that help is available, that especially for our first responders, you don't have to be alone. You're not alone. There are resources out there to help you. We want to help as I guess as a nonprofit organization in our state in South Carolina. SE Thrive is here to help. Connect with us with the resources that we have, whether it's listening to our webinar, our Mental Health Matters, whether it's taking our 8-hour course in person for mental health first aid for public safety officers, or whether it's even doing our virtual training that we have for mental health first aid that you are now, leading the way with, George. So, and then in all of our trainings, we offer other resources that are out there. So you don't know what you don't know. And so my takeaway would be is to reach out to us, whether it's on our Facebook page, on our social media, on our website at sethrive.org, our call center. We are here to help you, first responders. And we want to salute you and thank you for, again, just the incredible work that you are doing. George, I'm turning back to you. Any final thoughts that you have for folks that are out there watching this this conversation?
When I became a mental health first aid instructor, my first wish was to anyone that I was reaching out to teach the program to, I wanted to make sure that they knew every facet of the program. So at the end of the program, as you said, Stephanie, after spending 8 hours, I didn't want them to say, that's 8 hours I'll never get back. There are times where people may sign up for a webinar or a class, but we can assure you that if you take one of our virtual classes or you take a class in person, you're going to come away with some takeaways that you can use for life. And we have taught individuals that have had as little as no experience all the way to over 30 years of experience. And the veterans in EMS, those that have been in EMS for a long time, or law enforcement or firefighting, have always had takeaways. The thing I'll close with is we have an incredible project that we do in the class where everybody gets together and they draw what anxiety looks like to them. And quite frankly, that's one of the most priceless tools. It's something that I look forward to every time, because it just gives everyone an opportunity to look inside and look at what we face every day, because anxiety is unfortunately one of the biggest drivers in our lives every day. But thank you all so much for what you do, and thank you for supporting mental health first aid.
Well, thank you so much, George, for coming on Real People, Real Conversations with us today. And thank you so much for the reminder that even our unstoppable heroes need care and attention too. I think that's really easy to forget and something to not think about all the time, because we do see them as heroes. They're the people helping everyone, but even them, they definitely need help. So thank you so much for joining us. Stephanie, thank you for co-hosting. And
Absolutely.
if no one else has any thoughts, we would like to go ahead and sign off.
Thank you very much. Have a great day.
Thank you, George. Take care.